We're having a series of conversations with our partner surgeons around the world, and I am absolutely delighted to be here in London today and welcome Dr. Neema Kaseji and learn a little bit more about what she does. Welcome.
Thank you so much, Gareth. Thank you for that lovely introduction. It's a privilege to be here with you and to see you in person.
Great, yeah.
And thank you so much for having me.
Good. And I think all our viewers would love to just hear a little bit about, who you are and what you do and your association with Kids OR and obviously your important work as a rock star pediatric surgeon. Can you tell us a little bit about your work?
Sure. So I'm a pediatric surgeon, humanitarian pediatric surgeon, and also a public health specialist. And my focus is working in last mile communities, so communities that are caught up in conflict, rural communities, refugee communities. And I've had the privilege to serve in Central African Republic, in Haiti, in the Democratic Republic of Congo, Liberia, and now Kakuma refugee camp.
Great. And you mentioned Kakuma refugee camp. I think that's the reason we're here today, the work that we're doing there. So Kids OR was asked to help install an operating room in Kakuma back in 2019, and we made that public, announced that publicly at the World Economic Forum in Davos. And 2 years later, we have now opened. We were in Africa last month, in Kenya last month together, and it was so good to see you again after the pandemic, and we haven't seen each other for a couple of years. So it was great to be in Kakuma. Can you tell us a little bit about the OR that we've installed in Kakuma, and maybe focus a little bit on the impact it's had on the community, the before and after, what could children access in terms of surgery before and what is it like now?
That's a fantastic question, and perhaps I can begin with some numbers just to illustrate the challenges that we have. So as many of you know, we reached a milestone of 100 million refugees fleeing conflict, fleeing discrimination, fleeing persecution. And a lot of these refugees are women and children. And Kakuma refugee camp hosts about 200,000 refugees, and again, women and children. And the systems that we have in place now are really not designed to care for our most vulnerable. So currently, women and children are being left behind. And the situation when it came to surgical conditions for children illustrates how women and children are being left behind. So before we installed the Kids OR operating room, a child with a birth defect, a child with an injury, a child with cancer would not get the care that they needed to survive. If they were lucky or if their parents had some money, they could be transported for 13 hours, but that was not accessible for most children. And many of those children did not make it through that journey. And so what we've done right now has had a huge impact for these children. Installing that equipment, installing that infrastructure, creating that space that allows life-saving surgical care to happen was really critical to making a difference. And just 6 months after the installation, we've increased the number of children accessing surgical care by 40%, and we're on track to double that number of children.
Incredible.
And so now we've shown that it can be done. We've shown that it can be done, and we're including surgical care in that essential health package for children, for both the refugee children and also for the Turkana children. And so it's been a privilege to participate in this intervention, and I'm really thankful for all of our partners, for Kids OR, for UNHCR, for Biltema Foundation, for IRC. We've also shown how effective partnership can make a difference in a very short time, because 2 years is a short time to get all of this done and to see an immediate impact for these children.
You mentioned our partners, and the desire is that we get to a point where the operating room in Kakuma can operate on up to 1,000 children a year. You've already been operating in the refugee camp since the operating room opened. Is there an operation that you've done that was memorable? And I also want to talk about the fact that I believe your team there operated on 17 children in one day. So, I mean, that's phenomenal. I've never heard of that. So, I mean, I would love to hear about, what's that was like that day, and also, is there any memorable surgeries you've done since
Yeah, absolutely.
we
So that partnership has happened, yes, at the level of UNHCR, IRC, but we've also had a partnership with regards to specialists and surgeons who've seen what is happening in Kakuma, and they've decided to come and they've decided to join this effort. So when we were last together in Kakuma, there were 5 other specialists who were there: an orthopedic surgeon, an anesthesiologist, another pediatric surgeon, and a general surgeon. And we just came together, and in one day, we each did about 4 surgeries, and we were able to take care of 17 patients, including a gunshot wound to the abdomen, who would not have survived otherwise. And so that really shows again that partnerships, both those global partnerships are critical, but then local partnerships to get everyone on board. And we've seen a pull effect from that installation. So having that space, having that infrastructure has attracted the local specialists to come and to serve within Kakuma. And that's another positive story to tell. In terms of a case that I did that was memorable, there is one particular case that was very, very touching. A mother who brought her 5-year-old who had lived with a birth defect since birth, and that prevented her from going to school. And you actually met her. She's the one I kept carrying when we were together in Kakuma. And that mother walked 100 kilometers to reach us.
To access that care for her child.
To get care for her child. And now her child received her operation. She has healed, and now she's in kindergarten for the first time. And so it's not only about saving lives, but is also providing these children with opportunities to go to school, opportunities to fulfill their full potential, and to build the economy of their country, and to contribute as members of society. And so the impact is not just at the individual level, but it's at the societal level. Yeah. And what touched me most about this case was how the mother did everything in her power. She literally had nothing, but still made the effort to walk 100 kilometers to get her child the care she needed.
No, and you touched on it. It's not just the direct impact of a child who has surgery, but everything else that impacts on, and it's phenomenal. Yeah. And we look at children who live their entire life with a disability or in pain because of a surgically, often a quite simple surgically treatable condition. Yes. And it's great to see, part of what we've talked about is, delivering surgery is complicated and expensive, and I would say even more so that perception within a refugee camp. So what's fantastic about Kakuma and your team there is that we've blown that myth, and it can be done.
It can be done.
Yeah, no, it's fantastic. Neema, why is it so important that children in refugee camps are able to access this type of essential care?
Well, the number one reason it's a rights issue. Every single child has a right to health, and in order for a child to attain that highest possible level of health, very often they need surgical care. Yeah. They need surgical care. They may need surgical care at birth because of a birth defect. They may need surgical care because of an accident if they fall off from a tree and break a leg. They may need surgical services for an infection or because of acute appendicitis, which is very, very common. And so in order to fulfill that right, there is a need to include essential surgical care as part of that health package for children. So that's number one. And then when we look at some of the policy frameworks and the discussions that have happened, we have everything in place supporting essential surgical care. So we have the SDGs and SDG 3, which we will not attain without surgical care. Every single person will need surgery at least once or twice in a lifetime. We have universal health coverage, which is critical, and for us to attain that, we need surgical services. If we look at the refugee population, again, they have a right to health. We have frameworks that declare that there needs to be more solidarity, and that's even more important today because we've reached that milestone of 100 million refugees across the globe. Yeah. And so there's a huge crisis at the moment, and they deserve access to essential health services.
Absolutely.
They deserve access to surgical services. And what we've done in Kakuma is that we've shown that, yes, we can do it. We can do it with the proper investments, with the proper infrastructure, equipment, and training. And if it can be done, then we must ensure that refugee populations have access to surgical care.
And I think this is probably going to be an obvious answer, but what made you so passionate about these children that are in a refugee camp and about the refugee crisis? I mean, you talk so passionately about 100 million people. Children or people? People. People. So 100 million people.
And most of them
who will be refugees, likely more than half women and children. What is it that makes you so passionate about this subject?
What I'm passionate about is equity, and I've spent my whole professional life addressing equity and the lack of equity. So whether it's access to surgical services, right now 5 billion people do not have access to surgical services. Out of those 5 billion, 2 billion are children. Whether it's COVID-19 vaccines, there is inequity in that as well. Whether it's access to critical care and ICU care, there's inequity everywhere we look. And so my mission in life is really to address equity, and I go where there is most injustice, and refugees have been left behind even more than other populations. And so I go where the need is highest, and that's my mission.
Well, they couldn't wish for anyone better to look out for them.
Thank you.
Yeah. I mean, I remember before I started Kids Operating Room, I had no idea about the issues around capacity for surgery for children. And my own children who themselves required a surgical intervention to survive, and what we take for granted in this country. And really, it wasn't until I started to learn what was going on in the rest of the world. And I knew that healthcare systems were basic and there were issues around accessing healthcare, but I had no idea how many children were just dying waiting for surgery. And there was no services for them. And the refugee camp in Kakuma is a great example of that. And as you said earlier, it can be done. With the right commitments, the right partnerships, with people dedicated like yourself, it can be done.
It can be done.
I think one of the things I've been told is that it's difficult, it's expensive, it's really challenging to do it. Have you found that when it comes to telling the world about the lack of capacity for surgery, trying to encourage governments, NGOs to focus on investing in surgical capacity, especially in children? Have you found that, those voices out there, the doubters, the people that say it can't be done?
Absolutely. You find them everywhere. But I think the best response is to say, okay, you are entitled to your opinion, but we're going to do it anyway. And let the work that we're doing convince the doubters.
And was that more so in a refugee setting than normal?
Probably more so, just because it is a special population. They require more protection, just because many of them are fleeing persecution, they're fleeing conflict, and there's a tendency to focus on on infectious diseases and on immunization, and those things are critical.
Yep.
But we also have to recognize that they have surgical needs. They have burns, they have injuries, they have birth defects that we can't just ignore because it's not part of the agenda. And so we have to recognize that part of providing good care for these children, that will mean including surgical services.
Yeah, of course.
And yes, there will be challenges. We will encounter challenges, but that doesn't mean that we don't even try. And so in Kakuma, we've tried, and we've shown that it can be done. Mm-hmm. And I'm really excited to see us replicate this model in other places so that we can really reach these children and provide them with the care that they need, because there's no point feeding them. There's no point giving them all their routine vaccinations, but if they break a leg, we say, no, that's it. That's not, we don't go there.
Of course.
And so if we want to fulfill that right to health, then surgical care will need to be included in that essential package for refugee children and for children everywhere.
Yeah.
And so that's just part of us fulfilling that right to health. And if we look at global targets, we need to include surgical care to meet the SDGs and to also meet what has been pledged in terms of universal health coverage.
So Neema, when we started Kids Operating Room, I think the initial model was that we would develop these beautiful state-of-the-art operating rooms with over 3,000 pieces of equipment and give surgeons across low-income countries the essential tools and safe space to do surgery. We quickly realized that in order to keep expanding, we needed to also start partnering with governments and also colleges to train pediatric surgeons and the wider surgical team to support them. You're very involved in training that new generation of surgeons. Immensely powerful, important work. Can you tell us a little bit about it?
Absolutely. And first of all, I want to commend you and your team in terms of your agility, and you didn't stick with the same model. You were able to take in new information and take in needs and adjust that to a more comprehensive intervention, and that doesn't happen every day. And so, congratulations to you and all of Kids OR. And so, when we look at the whole system, the system includes the infrastructure. So, you want basic infrastructure, you want water, you want electricity. Then the system includes also equipment, and that's critical for a surgeon to have, so they can do the proper procedure for children, because children are not just small adults, but they have different pathologies.
Of course.
And they also have different needs, and you can't use the equipment that you would use for adults in a child. So that also is a critical piece of the surgical system. So infrastructure, equipment. And then the other very, very important piece is the workforce. And the workforce is, in my opinion, the most important piece, because a good workforce can actually make up for some of the limitations in infrastructure, some of the limitations in equipment. But the equipment can't do this. Can't make up for the workforce. And the infrastructure cannot make up for the workforce. So that workforce component, in my opinion, is the most critical piece of the surgical system. And therefore, it requires that we really invest in that workforce. And when it comes to Africa, Africa is the youngest population in the world. And we have the least number of pediatric surgeons and the least number of pediatric anesthesiologists. And so we're way, way behind. And we need to accelerate the training of our workforce, that important piece, so that we can care for children. We can adequately care for children who are already there and the children that will come in the future. So that workforce bit is critical, that critical piece. But it is also, it works well with the other pieces of the system, and that's the infrastructure, and that is also the equipment. And so your comprehensive approach is the right approach when it comes to strengthening a health system, and also it's the way it's the approach we should take as we scale up the Kids OR model in both refugee communities and other communities.
Yeah, and thank you for your kind words. I mean, when Nicola, David, and I started Kids OR almost 5 years ago, it was one of the very first things we said was, it has to be local surgeons caring for their own nation's children.
Yeah.
And the existing mission model just wasn't going to work.
Yeah.
And I'm so proud. I'm so proud of the installations and seeing, as you said, seeing the equipment is so important, but without the right people.
Yeah.
So the fact that we're now involved in training and the scholarships that we have in place to train the next generation, the future of surgery in Africa and across low-income countries, it's just something that we're all, I know you are as well, we're all very, very proud of our involvement in that. So it's great. So there's a lot of big donors who are involved in health across low-income countries, healthcare across low-income countries. We're not all getting it right. What would you say to donors, international NGOs, about how they can better fund healthcare in Africa? Let's focus on Africa. In Africa, for example, are they getting it right? And are we doing aid well? And if not, what are we not getting right? And what would you say to someone like me? How do we get it right?
So that's an excellent question. And when it comes to getting it right, I think it is critical to be more inclusive in terms of framing the challenges. So I think a great way would be to include children who've benefited from the surgeries that have happened in Kids OR operating rooms, or including parents, because often what happens is that there's already an established global health network, and so you will see many of the same people in the same locations. So it's Geneva, it's Nairobi, it's Kampala, and there's often a disconnect between that network and the people who are being left behind. And so for me, for example, I make an effort to make sure that I'm right there with the people who need us the most, so that we can interact with them, so that we can really, truly see what the challenges are, and also better understand the challenges and include them as we develop solutions, so that we're not working with assumptions, we're not working with what we think their challenges are and what we think the solution should be. And so I think inclusion is critical to getting it right. It's critical to actually know where we need to put the investments. It's critical to understanding the challenges, and it's critical to actually developing solutions that will work, that will have the support of the different stakeholders, and therefore would be more sustainable over time, whether I'm there or not. If everyone is on board and everyone is included, the intervention will continue and will be independent of my involvement. And that's the ultimate goal.
Yeah, and your point on inclusion is so important because, honestly, I think sometimes we forget the simple things like asking, what do you need?
Yeah.
What do you want?
Before you even begin.
and establishing relationships with the right people. With our work, it's so important that we have a good relationship with the Ministry of Health.
Yeah, absolutely.
With the directors of hospitals, with you guys, the surgeons. What do you need? What can we give you to make your life easier? Yeah. But it's amazing how many organizations don't ask these simple questions and should start thinking more about inclusion. The word, it's so important, but it's just sometimes we forget to just ask, how can we help?
And inclusion is actually better for everyone, because I can also see the position, I can also understand the position of the donor who's invested, a lot of money, but they're not seeing the impact they would like to see. And I also understand the position of the beneficiaries, because someone is just randomly flying in and telling them, well, this is a good thing, and get on board, and to be polite, they'll let you do it, but it doesn't really fit in with what their needs are and what their challenges are. And so inclusion is a win-win for everyone.
Yeah. I would love to see donors ask more.
Yeah.
Like, how can we help?
Yeah.
Like, what do you need?
Yeah. And humility is important.
Of course. Yeah. You work regularly, Neema, with youth organizations. Why is it so important to you that they have a voice when we talk about global health?
It's critical to include the youth, and because in my opinion, including the youth allows you to have a sustainable solution. Minimum 50 years, if you think about it.
Yeah, of course. That's a good point.
And if they were included in framing what the issues were, and if they were included in developing those solutions, they can be there long after we're gone. So it brings in sustainability. They're talented, they're energetic, they're committed to making a difference. And lately they've been showing leadership. When we look at climate change, a lot of those climate change leaders are young people. When we look at some of the biggest challenges that we're facing as human beings, the youth are taking the lead. And so I think it's important that we support them, that we provide them with any mentorship that they may need, that we provide them with the resources that they need to be more effective. And so, I'm inspired by them, and so I love working with the youth.
Yeah, great. Last question, but an important one. I know our desires as Kids OR is to do more in refugee camps across the world. Like you said, there's 100 million refugees. I'm sure that's just going to get bigger over the coming decade. Where would you like to see, we've built this incredible pediatric operating room, the world's first in Kakuma. What would you like to see next with regards to refugee camps, increasing capacity for surgery? What's next?
I would love to see us do the same thing in other refugee camps, whether it's in Africa, in Europe. There's the current Ukraine refugee crisis, so there's a need in Europe as well, in Latin America also. And we've been able to show that it can be done, even with many challenges. It can be done. And for us to meet our goal of providing health services for children everywhere, and to meet that right to health for children, we need to be able to provide surgical services in refugee camps, and we've shown that it can be done, and let us do it everywhere, all over the world, because every single refugee child has a right to health, and for them to attain that right to health, they need access to surgical services.
Yeah, well, that's a great answer. I think you're extremely committed. We're extremely committed to it. We know it can be done. We've shown the world it can be done.
Yeah.
So we should absolutely continue to prioritize the refugee settings and look to where we can support pediatric surgery within these camps. So, But listen, it's been so nice chatting to you.
Yeah.
You're a real inspiration to the entire Kids OR team. We're so proud to be partnered with you as one of our surgical partners, and we're inspired by your work, and we can't wait to do more with you over the next coming years.
Thank you so much. It's been a real privilege to work with the Kids OR team, and thank you for joining us on this journey, because I remember our conversations before Davos, and I said, okay, so let's do this in Kakuma refugee camp.
Yeah.
and you guys were fully committed from the beginning.
Yeah.
And so I'm very, very grateful for that commitment. I'm very, very grateful that you followed through, and we're having an impact, and I can't wait to see what we will achieve together.